Hi, my name is Bailey Phillips, and I'm going to be presenting the How to Choose an Evidence-Based Practice from my group. We did the Incredible Years program versus the First Step to Success program. I didn't show the PowerPoint in my presentation because I know that it's only one person is supposed to turn it in and that she already has it, but I'm reading and my presentation is based on the PowerPoint. So what is an EBP? It's an evidence-based practice. It's strategies that have been proven to produce positive outcomes through high-quality research studies. So to be considered an EBP technique, it must have a positive effect on student outcomes. It has to have been the subject of multiple high-quality studies, and it has to have been reviewed by a reputable organization. Why should educators use an EBP? So by implementing one, there will be increased probability of positive outcomes, increased accountability because of the extensive data that the program is backed up by, less wasted time, and fewer wasted resources because educators are not relying on trial and error to choose a practice, increased chance of meeting students' needs. So it might not be possible to find a practice or program that exactly matches the student and the setting characteristics, but in this case, you should just identify a practice or program that matches just about as many characteristics as possible. So what should be considered when choosing an EBP? So students and settings. So what skills does the practice address? Do the outcomes align with what you're trying to do? Were the research participants comparable to your students? Was the setting similar to your setting? Does the practice meet the required standards of your state and your district? And then also, I think it helps to consider the family's needs and circumstances by selecting the practice that best fits that specific family's routine. So what should be considered when choosing one still? So resources, how much time will I need to implement it? What are the initial and ongoing costs of implementing the practice? What's included with the program as far as materials for the teacher or the student, training materials, and what will I need to procure? What kind of training is necessary? And educators can also consider the option of collaboration by supporting their peers, such as helping to research an EBP or sharing the associated costs. What should be considered when choosing an EBP still? Evidence level. Consult several trusted sources that have reviewed the practice, determine how they rate the practices, compare ratings of similar practices to choose the best fit. To truly understand the target concern, what particular students need or what issues need to be addressed. And although a practice or program is considered evidence-based, it isn't guaranteed that it's going to be effective for all students, so you really want to take the time and take all of these things into consideration when choosing. So how to tell if an EBP is fully supported. To be fully supported, the program has to be proven, so there has to be evidence backing that it actually works and it has real results. To be considered having strong backing evidence, it has to contain random controlled trials that are designed well and implemented well. The trials have to show effectiveness in at least 2 school settings, or they have to be in a similar setting as that classroom. EBPs can also be backed by possible evidence of success and effectiveness. So if the quantitative factors are missing and then the EBT is not supported, randomized trials will not be as strong, but they'll still show a level of success, and comparison group studies can be very closely matched in characteristics. So choosing an EBP for kindergarten students with behavior issues, we compared and contrasted the Incredible Years and the First Steps to Success Early Intervention Program. So program description, the Incredible Years is intended for children up to 12 years of age with challenging behaviors. The components include children, parents, and teachers. They can be implemented to just one specific kid or the entire classroom, and they help build social and emotional skills. So First Steps to Success is intended for children at risk for aggressive and antisocial behavior. It involves a trained behavior coach who works with targeted students, their peers, their parents, and their teachers. It includes 3 modules: screening, intervention, and parent training. So who was observed in these studies? The Incredible Years participants were pre-K to 2nd grade, 79% European American, 90% male, exhibited noncompliance, aggressions, and oppositional behaviors. So First Steps, the participants were also in kindergarten, but it went up to 3rd grade. They were 37% low income, 16% were not native English speakers, and they exhibited antisocial behaviors, severe tantrums, and aggression. So where was the program implemented? So the Incredible Years child participants and parents were seen at a clinic. The teachers were trained at a clinic also 4 days per school year. The classroom sessions occurred about 2 to 3 times per week, and they also had home activities included. And then First Steps, there was a trained behavior coach that visited the classroom and the home. Resources, what did the program cost? The Incredible Years cost $11.64 to $30.03 per child, and it just kind of depended on what components were used as far as the child, the parent, the teacher, and then First Steps to Success, it was $500 per child, and it included all the materials and the behavior coach's time as well. How much time is required? So the Incredible Years, the child participants received therapy for 2 hours twice a week at a clinic. The parents also did 2 hours twice a week at the clinic. The teachers had 1 day of training, and that was 4 times per school year. The classroom sessions were for about 20 to 30 minutes, 2 to 3 times per week. And the activities for children and parents were sent home with them. First Steps, the program was implemented during 30 days in the classroom, and the behavior coach and the parents met for 45 minutes each week for 6 weeks. And then again, what training was required? Incredible Years, so the child was 2 hours, 2 times per week for 18 to 19 weeks. The parents were 2 hours, 2 times per week for 22 to 24 weeks. And the teachers were only 4 days per school year. First Steps, it was children and the teacher, the classroom time for 30 days. And then the parents were 45 minutes per week for 6 weeks. Required materials, are they included or does it require additional resources? The Incredible Years, they had weekly homework for children and the parents, and that was included. And then First Steps, they used a screening tool, class and home-based modules, the behavior coach, and it was all included. So what does research say about the program and the level of evidence? So the Incredible Years, it had potential positive effects on external behavior and social outcomes. First Steps, it had positive effects on external behavior, and it had potential positive effects for emotional and internal behaviors, social outcomes, and other academic performance. So what if an EBP doesn't fit? So sometimes they don't always fit because the student has a specific need or there's not enough resources, but what you can do in this instance is select a program that meets most of the needs, if not all of them. Just be aware that when you're selecting something that doesn't meet all of your needs, that the results may vary from the normal. You can search for federally funded programs and resources and read through the sources for yourself. And if you're still not sure, it's sometimes helpful to look into programs that aren't necessarily listed as EBPs. Just because a program isn't proven doesn't mean that it's not useful. It's just that it doesn't have enough evidence to support the results to be classified an EBP. So who did we choose? So there was pros and cons for both sides of these, obviously, and both programs showed some level of evidence, and the quantity and quality of evidence shows which program was ultimately more effective. And so the program that we would choose is First Steps to Success. The reason is that there was a more diverse student population. It included male and female participants. It was a lower cost, and it showed that it had better results in the end. Thank you.